and thank you to all of you. I know it's a bit late for some of us, so I would try to not take much time. I'll share my slides now.
हम 7:30 तक निकाल सकते हैं।
Can you see my screen? Okay, great. So good evening, everyone again. So today I will talk about our work on Karnataka's Shakti scheme, which is the state's fare free public transport scheme. And it was launched in June 2023, and it was announced as part of the government's 5 guarantee schemes. And it allows women and transgender individuals to travel for free state-run non-luxury buses. And the scheme was particularly launched to ease women's mobility constraints that limit their education or employment access. So, in the first 2 years, we see 500 crore tickets being issued, and also we see rapid surge in the daily ridership. And during the 2023-24 financial year, the government allocated 4,000 crore on the scheme, which was increased to 5,015 crore in 2024 and 25. And in the recent financial year, the allocated budget on the scheme is 5,300 crore. And at the same time, we see multiple reports of how women are traveling to pilgrimages and how women are traveling more, saving more, and it's helping poor women economically, and they are undertaking longer commutes. It's boosting tourism and local markets. So we conducted a travel survey to understand more about how the schemes like Shakti impact women's paid work. But at the same time, we need to keep in mind that fare-free public transport is just one piece of the puzzle, albeit a big piece, but other reasons like availability of jobs locally, childcare responsibilities, safety, last mile options, skill, education access, and social norms, and multiple other factors that keep women out of the labor market. So without movement on several of these fronts, any lasting change is unlikely. And that is one of the reasons, that is why one of the reason, like one of our focus was to talk to women who were already in the labor market and how Shakti has impacted their work-related travel. But first, I will quickly talk about the context within which we examine women's access to labor market under the Shakti scheme by discussing other important work that has been done and how mobility is linked to well-being and dignity and what factors shape mobility and how the impact of mobility is also different across socioeconomic groups. So looking at fare-free transport schemes around the world, we see that in Germany, a similar scheme increased respondents' leisure activities and social visits. In Kansas City, United States, respondents reported more health visits. They could retain jobs better, and also an increase in social interactions were reported. And similarly, in Washington, D.C., United States, we see respondents, they could increase their employment search, and also the unemployment period was much shorter than before. And similarly, in United Kingdom, we see improved health outcome among the respondents. They reported more walking, they also reported reduced isolation and so on. But looking at fare-free transport schemes, in India, when we shift our focus from those financially well-off countries to India, it's very important to understand that the benefits are not same for everyone. There are multiple structural inequalities that determine who moves and how they move and what opportunities they can access. So in India, Article 19 of the Indian Constitution guarantees all citizens the right to move and reside freely throughout the country, but only very few are able to exercise these rights in reality. And studies also show how women's mobility across the country are impacted by safety concerns, which is also a result of male dominated public spaces, financial burdens that make dignified mobility a distant dream for most women. For example, a study in Mumbai, Munisa Mahmood Alam and others, they find significant difference in men and women's mobility pattern. So, on one hand, women chose slower, more expensive modes of transport to travel similar distances that men did, and also women traveled more by foot that compared to men, and women also tend to work from home compared to men due to safety concerns. In Kolkata, one study by Sanghamitra Roy showed that women tend to do more break journey and they end up paying more money compared to men. And along with other factors such as poorly maintained footpaths, irregular first and last mile services, safety concerns, which affect women's mobility decisions. In a similar study by Girija Borkar, she found that university students, they their daily commute can go up to by 40 minutes to avoid unsafe routes compared to men whose average detour was only 4 minutes for the same reason. And this there is also overwhelming evidence that mobility constraints for women are one of the most important factors that impacts women's labor force participation. Yet, public transport has rarely seen as a policy tool that address this. And most common outcome of limited transport is that when the accessible, safe transport is limited, women's labor force participation is also limited. On the other hand, when people live next to metros, it also has positive correlation to women's labor force participation. And along with it, how women move is also a broader reflection of the caste and class inequalities. For instance, poor women spend a lot more time walking, and also they spend a high amount of their wages on travel. In cities like Kolkata, Delhi, or Chennai, working class women spend hours navigating the crowded or irregular transport system, and they also did higher trip chaining compared to men. So, trip chaining means combining multiple errands or stop, like dropping a child at school, going to work, or buying groceries into a single journey instead of making separate trips. And in rural areas, while the literature is limited, women also face similar burden, but the added challenge is limited connectivity that they also face. So there are a few studies. One such study is by Shilpa Agarwal. It shows that when roads are paved and the infrastructure is gender sensitive, for example, public spaces are well lit, the transport is reliable, buses arrive in time, we see more non-agricultural sector employment in rural areas, and also we see better access to public health care, and also shifts in social norms and even reduced domestic violence. So, in short, what I mentioned earlier, that we recognize that factors such as social norm and unpaid domestic and care work responsibilities can impact women's access to the labor market. And what we try to see here is if a public transport intervention like Shakti can put a dent in that. And over the year, we see various states have implemented free bus schemes. For example, Delhi's Pink Ticket Scheme, which was launched in October 2019, it saw a 25% increase in the female ridership. Women reported more savings. And it particularly benefited low income women who started using the buses only after the scheme was introduced. A similar scheme in Punjab was introduced in April 2020, 2021, and we see ridership doubled from 62 lakh to 1.12 crore in just 1.5 years. And also, interestingly, courier companies started employing more women and saved a lot of money that way because women can travel for free and do the work at the same time. In Tamil Nadu, the Vidyal Panayam scheme was introduced in May 2021, and we see more increase in rural employment, and particularly it benefited the street vendors, and which brings us to Karnataka's Shakti scheme. And I feel like I keep repeating this, but we need to understand that a scheme like Shakti takes time to have any lasting impact on women's labor market participation. So what we aimed here to understand here is whether there have been any initial impact on how women access the labor market. So we conducted a survey after 18 months of the scheme's rollout, and we also wanted to move away from the urban areas where most transport studies are conducted and instead focus on rural and semi-urban areas where transport networks and both job opportunities for women are limited. So we conducted the survey process in 3 stages. So first, in the first stage, the researchers visited certain districts in Karnataka to gather some preliminary information on women's labor force participation and if that has changed post Shakti. And in order to do so, they talked to different stakeholders such as division controllers, depot managers, traffic managers of the respective districts, and so on. And based on the information that we've gathered, we finalized 4 districts for our travel survey, which are Chamarajanagar, Mandya, Chitradurga, and Kalaburgi. So we have Chamarajanagar and Mandya on the southern side. Chitradurga is more like it's in the middle, and Kalaburgi is in the northern Karnataka. And because we wanted to focus on Shakti's impact on paid work, we tried to find women who are using the buses frequently for work. And based on the information that we collected about the type of occupation women generally engage in these districts, we selected 4 categories: agriculture sector, manufacturing sector, service sector, and other informal work, typically occupations that are low wage, informalized, and has no lower minimum job security. And in the next stage, we screened 1,134 women, and we conducted the final travel survey with 239 women who fulfilled the occupation and the frequency criteria and also consented to the interview. So here we aim to examine the mobility change for women who already use the bus. And this study does not claim to speak for women who never or rarely travel because of care responsibilities or social norm that keep them out of the labor market. And lastly, we conducted 5 in-depth interviews with women who reported substantial changes to their livelihoods post Shakti. At the same time, I feel it's very important to mention the challenges that we faced while conducting the survey, because we focused on the rural peri-urban areas with limited transport networks, and we also wanted to find women who travel frequently. So some locations that were initially considered for the study were later excluded because of limited bus connectivity, low number of women who were engaged in labor market, or just because women relied on privately arranged vehicles. And many traveled also for shorter distances, or some just walked or lived close to their work site or didn't travel frequently. And also finding them in the public spaces like the bus stops, it became a challenge because of the timing issues and because women didn't have time. So our researchers couldn't really go and talk to them. And reaching women in remote villages were also difficult because timing proved to be an issue. Women leave early, they come back late, they work during the weekends, and they also have, which also gave us limited interaction opportunities. Lastly, our reliance on locations like bus stops or markets might have introduced selection bias because people who follow different routines were not present in those areas when the researchers visited. and which might have led to their exclusion. So this is strictly a non-probability sampling approach. And lastly, because there is no baseline data available on women's bus usage pre-Shakti, identifying the shift in the mobility pattern was difficult. So we relied on their retrospective travel patterns that women reported. And to make responses more accurate, we anchored our questions to meaningful distance categories rather than absolute distances like kilometer or miles, such as within the gram panchayat, outside the gram panchayat, but within the taluk, outside the taluk, but within the districts, and so on. So it was easier for the women to report any changes post Shakti. The reason I mention all of this is to point out the structural and logistical difficulties of studying transport interventions among working women, especially in the rural areas in informal labor market settings. So in our tool, we asked questions about their socio-economic background, experience of the scheme, their perception of safety, infrastructure, paid employment, and so on. And almost all respondents said that they saved money because of Shakti, which mostly went towards household expenses, children's expenses, and also minority, only 2.5% of the respondents, they said that they use the money for repaying their loans. And at the same time, 3.8% of the respondents said that they use the money for medical expenses and so on. And when we asked about their overall experience of the Shakti scheme, we mostly see positive responses. So women across all districts say, despite of the limitations, that the bus service is convenient, planning routes is easier, and now they have a sense of peace knowing that travel cost calculation is not needed. And women felt more independent because they don't have to rely on family members on travel now. So the findings show that Shakti has not only enabled women to save money for essential household, medical, or other essential expenses, but it also has enhanced their mobility autonomy. And women connected this feeling of independence with greater sense of dignity as they no longer had to rely on family members for travel, or they no longer needed to plan their travel around transportation cost. And when it came to safety, during the day, most respondents felt safe while walking in their daily travel area or riding the bus. However, this sense of security dropped at night, where a significant number reported feeling afraid. But also the fact that because of the scheme, more number of women are traveling on the buses it also improved their overall sense of safety. A similar trend is also observed at the bus stops. Most respondents felt safe getting on and off the bus during the day, but this sense of safety also dropped drastically, considerably at night, with a notable amount reported that they felt afraid, mainly due to men loitering, the bus stops were dirty or poorly lit, or there were alcohol bottles lying around. So the sense of fear also went up. And in terms of convenience and facilities, we see mostly positive responses. 74% spent considerable time at the bus stop. So more women demanded that the waiting rooms be available at the bus stop, that they can use 24/7. And because right now in those areas, most of the bus stops are just tiny shades that just they do not protect them for sun, heat, or rain. And also, a large number of women report that accessing the handrails or grab handles in the bus is difficult for them due to height difference. And some also report that the foothold to the bus is not at a decent height. So these infrastructural challenges or convenience related challenges were also reported. So, coming to paid work, women across all occupational sector reported that it has been easier for them to reach work or work-related locations after Shakti, and that they also have been able to access labor markets further from home. Especially, we see this trend among manufacturing sector workers, but At the same time, we see less respondents reporting that they found jobs for more days than usual or found job with better wages. At the same time, one-fourth of our respondent group said that work-related travel, it has become more convenient for them. They had to rely less on autos or private vehicles, and they can retain most of their income that way. And some also started traveling to neighborhood villages or nearby urban areas, and they felt independent while traveling for work and they reached home or work faster. And we see this improvement across age, caste, and religious categories. So here is a case study that like I wanted to show you. But we interviewed this woman who is a street vendor, and her name was Manjula. So she is a novelty item seller from the Mandya district. So she reported her daily earning before Shakti to be around 500 to 1000 rupees. And she used to travel to neighboring villages, which cost her about 100 rupees a day. And she would made her sourcing trips to Nagamangala, which is the taluk headquarters, once in every 10 days to stock up on her raw materials. But after Shakti was introduced, she reports that because of the free bus now, she has expanded her sourcing network to Mysore and Bangalore, where she travels every 8 to 10 days to procure raw materials, and her daily earning has also increased up to 1500. So here we see that after Shakti, this particular respondent has not only expanded her travel radius or increased her trip frequency, but also she is able to save on transport costs, which she initially had to spend for traveling to different villages and also to make the procurement trips. But because of Shakti, she is now able to access bigger wholesale markets in Bangalore and Mysore, and the cost of input and raw materials is also lower, which increases her profit margin and also her earnings. But most interestingly, she reported that she would continue to travel to those further markets in Mysore and Bangalore, even if the free bus scheme stops, because now she knows that if she travels there, she would be able to get her input goods for a much lower price, which would be more profitable for her, which suggests long-term financial independence for the women. Uh, and then when we asked about what suggestions women had, they had for the scheme, most of them said that they need more buses, and they felt that the scheme should be continued, but with some improvement like better scheduling and timely arrival of the buses, and timing also should match women's work schedules, and also that overcrowding should be addressed, infrastructure should be improved, and so on. And 7% women said that the scheme should be stopped or restricted. And when we asked if women would be willing to pay a subsidized fare in exchange for better service, 55% of which is almost 132 women in the respondent group said that they would, and within them 60% said that they could pay up to 10 to 25% of the current fare, while 31% said that they could pay up to 26 to 51%, 50% of the current fare. So this suggests that reliable and improved transport matters more to many women than zero cost, and many were also open to co-paying for the quality and consistency. So coming to recommendations, we would want to reiterate on some of the suggestions that the Shakti users had, like improving infrastructure and connectivity, more stops in villages, improving the bus infrastructure, like improving the bus interiors, and also accessibility, more storage facility for the vendors, and also operational efficiency and service quality, like ensuring timely arrival of the buses and providing access to real-time information on the buses. And at the same time, we want uh, uh, that one of the recommendation is also that could be embedding this Shakti scheme into a law, like we have seen in some places like Luxembourg, Malta, or Washington, D.C. in the US, which has a free transport scheme embedded in the legislative system, because it would give women a legal right to use the service. And it would also make sure that women, especially those from marginalized background, can regularly um, benefit from free transport as part of their right to equal access to public service and mobility, and not just as a welfare measure. think, yeah, I think I'm done.
Um, Hi. Madhusree, I think stop sharing. Thank you so much, Madhusree, for that excellent and on-time presentation. And we're so glad so many of you could join us despite the late hour. So we'll open the floor to any questions you may have. Either you can put it on chat, or you can just unmute yourself and speak, or raise your hand, anything that's comfortable for you. Um, any questions you may have for the team, or more broadly on what we think about mobility and labor. Yeah. Yes.
Yeah, hi. Thank you, Madhusree, for that excellent presentation and your detailed explanation of the methodology and so on. I was wondering if you could share a little bit more about your findings from the key stakeholders as well. Might be making an assumption here, but my guess is these were mostly men. And anecdotally, I've heard a lot of complaints from men who've been riding the buses after the Shakti scheme. So I would just like to know a little bit more about. I mean, these are the people who are in a way responsible for the free movement of buses and ensuring that the scheme is carried out. What did they have to say about it? Thank you.
I think Madhusree, you can
Uh,
unmute and go. Yeah.
thanks, Abha. Thanks so much for the question. So, as you said, the stakeholders were mainly men, and we did talk to a lot of them. And and also we while talking to the women, we also heard a lot of uh, complaints from women about how they felt traveling in those buses, and how like the men were very, not happy with the scheme, because now they felt that they had to pay for the bus fare, and they didn't have seats because there were so many women traveling. And at the same time, women felt that it impacted their dignity, because the conductors would often yell at them. The men would pass night comments. So the women were not happy because of that, even though they were happy to travel, even though they were happy because they could travel for free. But at the same time, those issues are kind of cropped up. And we also talked to RTC officials, and also respective RTC officials in those states that we studied. And that is also, while this is not part of this report, we are also planning to write another report which particularly focuses on the stakeholder perspectives, while this report mainly talks about how women felt and how it changed, the Shakti scheme changed their labor market outcomes. But largely because of subsidy challenges, because of insufficient infrastructure, there were complaints in general. from the stakeholders, and also we interviewed some unions, the auto unions, where the drivers who were mostly men felt their income, the Shakti scheme hit them really hard, and it had a drastic effect on their income. So while I'm not going into too much detail, because we will have all of it in the next report that we share, uh, it was not a very happy, feeling from the stakeholders, from the main male stakeholders in general.
Thank you, Madhusree, for that response.
Any other questions? I think Ranjit has posted on chat. I'll just read it out for everyone. Overall, can one say that the scheme's benefits, I think, in terms of socioeconomic, were they commensurate with the subsidy, which is 5,000 crores? How would this work, for instance, if one did DBTs instead? Madhusree, do you want to respond?
So I feel DBTs would be a little challenging given what the objectives of Shakti are in this particular case, because uh, under this scheme, women across all socioeconomic strata can travel. But when DBT comes in, there are a lot of factors that also come in, which might be a little challenging. But at the same time, a lot of women also felt that the scheme could be more targeted, and only, working women from lower socioeconomic classes would benefit from the scheme. And so there were opinions like that. And your first comment, I'm still thinking about it. Mm. I mean, in terms
Yeah.
of fiscal benefits, it's too soon to say if the investment on the scheme would have, still, if it has any sustained or, tangible changes so far, but it's more like an enabler. So any, large scale scalable benefits would take more years to see, but I feel this is still something worth investing in, because while the labor market outcomes in the rural areas are still limited or very not uniform across regions, they still have positive impacts on women's um, labor market access or educational access. So this would, like if the changes, the budget changes and the evaluations are taken into account, and there are timely, changes in the scheme, and it's in the long run, I feel there would be sustainable changes in the long run. So what I'm trying to say is the monetary benefit is not so easy to calculate. It's too soon for that.
Um,
I think you can speak out your comment, Abha, as well. That would be good. And Ranjit, to tell us what you're
yeah.
thinking.
I guess I wanted to ask if you noticed any difference in the experiences of women of different ages? I guess I'm making some assumptions here about younger women who are newly in the labor force and would be, I mean, not to give it away, but did you find any experiences based on
Um,
age, difference in experiences?
Yeah, sorry. Ranjit, do you want to clarify your comment based on Prabha's question, whether you meant DBTs in general or specifically about travel?
I think I was thinking in general. They could be targeted for travel also, but no, I was thinking general because I'm from Maharashtra, where of course you know this the whole DBT thing has happened with with the government, and a lot of it may go towards travel, but it may also, of course, go towards other places where that saved money anyway was probably used, and is therefore a little more flexible. I mean, again, those are just very theoretical arguments, but I'm just, yeah.
So I mean, just very quickly on that, just clarifying in terms of our work that Karnataka actually has what it calls the 5 guarantees, which is 5 different schemes that they offer. So there is a Gruha Lakshmi scheme, which is a direct benefit transfer in the form of cash transfer, similar to what's in Maharashtra, and Shakti happens alongside. It's part of these 5 guarantees. Um, so part of our work in an upcoming seminar is to present our research across 5 guarantees. So seeing them together to see what to see it alongside each other, which is the cash transfer alongside other support, and engaging with what is the difference between, say, universal basic income and universal basic services. So just wanted to flag that in terms of this thing. So I will stop abusing my role as moderator and let Madhusree go ahead.
Yeah, Abha, to your question, we did find those changes were more or less uniform across all age groups, but when we tried to find out how women were traveling, if they were traveling outside the gram panchayat or they were traveling outside the taluk after the scheme, we see younger women are traveling more beyond the taluk, whereas the women who were slightly older, their travel radius is more or less confined within the Gram Panchayat boundary. Uh, but having said that, it's not very stark. Like the difference across age group is not very stark. It's just that a higher number of younger women are traveling further distances, traveling beyond districts or beyond their Gram Panchayat boundaries after the Shakti scheme compared to older women. But it's not that older women are not traveling, but the ratio is just a bit higher for the younger women.
And I just wanted to add that as part of our research on the guarantees, actually the reason for taking up this study was because when we did the study on the guarantees, we were going to the rural areas and meeting women in villages and asking how they were using Shakti. And actually, we didn't find a huge uptake of Shakti in those areas necessarily, right? And they were also very unhappy about the scheme because it was affecting children going from villages to schools. And so there were a lot of grievances around it. That's why we felt like we needed to get a better sense of how it was affecting women who are actually doing paid work, in towns, not exactly big cities, but in towns and not just the villages. So this was meant to be also somewhat of a corrective. And actually, Madhusree hasn't gone into this in great depth, but in the report itself, if you see, we are also looking at the experiences of women across different occupational sectors. So I think Madhusree can elaborate more. So depending on whether you're in manufacturing, the informal sector, the service sector, or agricultural labor, the travel patterns tend to be quite different, right, Madhusree, in terms of their uptake of Shakti. Maybe you can say a little bit about how, so it really impacts women in different occupations quite differently.
Yeah, so I didn't add the graph, but yeah, so what we found was women who are engaged in agricultural sector, they tend to travel uh, not so far compared to women who are in service sector or other doing other informal work such as domestic workers. And but on the other hand, agricultural laborers compared to the other groups reported more days of work. While it didn't necessarily translate to higher wages, their overall monthly income went up. So there were those variations across income sectors as well. And manufacturing sector workers at the like on the other hand, sometimes they tend to live near the work site, so they didn't necessarily use the bus. They often use their husband's uh, vehicle, or they just walked. So there are these differences across the occupational sectors that we found. And yeah, I think that's mostly it.
I hope that helps. Any follow-ups or other questions?
Has the government itself done any assessment of their own scheme, or is it too soon for them also?
Prabha, do you want to?
Yeah, I think the FPI has a report, but I think it's based on sort of like a macroeconomic analysis of how Shakti has contributed to the economy. But I think there are other research partners who, along with us, focus particularly on the Shakti scheme. So I think Chavi was here earlier, and APU, Azim Premji University, has conducted a study looking at the BMTC data, looking at the ticket collection data over an 18-month period, right? I think they've got all the roots in Bangalore. And so they have done a study and can answer the question that Abha had, I think, or maybe Ranjit did, one of you did, about whether this is worth it, the investment on the Shakti scheme. And Just Jobs Network also has done published 2 reports on so the government per se hasn't probably undertaken this study, but there are several research partners who have looked specifically on the impact of transport on paid work, but also, like the cost benefit analysis of running a scheme such as this. And we see a particular similarity across other states. I think in other states like Telangana and Andhra Pradesh, where these schemes have started, we are seeing very similar patterns of an initial period of tremendous contestation between many stakeholders. And this is something we want to write separately on about what are the distributive effects of a scheme such as this, and what kinds of pressure it puts on different stakeholders, both the service providers, but also the people who are receiving the services, and how different states are managing that. So for example, I think in Karnataka, there's some level of reservation for men, right, in the buses. And we're just trying to understand how this might be, but there is quite a striking similarity across states in terms of how they're perceiving initially the costs and benefits of the scheme. We wanted to sort of fine tune more the understanding around paid work, what exactly, because there is a lot of discussion about how women, the dignitary effects are very well explained, but very specific economic effects of this scheme was something that we wanted to map. And it's been very challenging actually doing this research. And in talking to other groups that are studying it, they found similar kind of challenges to basically, because you can't accompany the women while they're traveling. You have to meet them at the transit points. You can't actually always go meet them where they live to understand their travel patterns. So we've tried to come at it from different directions, some of it more conceptual and analytical. We also, and maybe Jehosh and Madhusree can also say a little bit about the travel diary that we try to really pilot and see how you can map women's actual travel patterns. Because I think, as Madhusree already said at the beginning, women use transport in a different way compared to men. But because we don't have smart cards, we don't have a way of actually tracking not only pre-Shakti usage, but also post-Shakti, how they're actually using it. Because there's just a ticket that's issued every time they travel, rather than, um, you know, uh, rather than mapping how a woman uses it over the course of a day. So, and for what purpose? So that's the reason why this research is particularly challenging. I don't know if Madhusree and Jehosh want to add anything to this.
So this report is just part of, so initially because we got so many data from so many stakeholders and it was so diverse, we wanted to write not one, but 3 reports on Shakti. So we also talked to women about their, as Prabha mentioned, we did a travel survey, we collected information from them over a week. Uh, about how they traveled, how much time it took. So we tried to map all of that uh, across those districts, and we find because it's a qualitative study. Any scalable impact is or any scalable result is a bit difficult at this point, but there are definitely socioeconomic changes that are happening in terms of savings, in terms of employment outcomes, in terms of education. But I just feel it's a bit soon to say, uh, if those outcomes will, if it's going to be like it needs more time, is what I'm trying to say. It's just so too soon.
Jehosh, do you want to?
And just one more thing, because this the travel diary that we adopted for the studies mainly in urban areas where networks are more reliable, it's broader. But doing this was very challenging because the means in some villages there are just 2 buses in an entire day. So documenting all of that was very challenging, but at the same time it was very I would say rewarding and very interesting. And we are hoping to uh, write all about it in the other reports that we are planning to share with all of you. So the challenges are similar, but sometimes they are more, they're just because the transport networks are limited in the areas, um, it, it's more complicated and it's not very linear or straightforward to measure any outcomes that in that manner.
Yeah, actually, in fact, sorry, I just wanted to add to that, so we had looked at other countries where this kind of work is done, like a spatial analysis of how, women are using. I mean, the idea of a travel diary actually came from some research we saw in the US where, I think the researcher was looking at African American women, if I'm not mistaken, trying to look at how they were using travel diary to really look at, how they were particularly disadvantaged by the lack of public transport. But I remember that when we were doing the research around the travel diaries, we found that the travel connections were so poor for the women who are working. Simply like, so this idea of trip chaining also is a very, it's a product of the conditions under which, this kind of, where you have a travel infrastructure, you can a working travel infrastructure, you could actually talk about trip chaining and say actually women use travel uniquely in this sense. Whereas what we found was in the rural context and the semi-urban context, just for the women to go from home to work and back was such a huge effort that at most they could buy groceries on the way. That was about the extent of trip chaining. So there are certain assumptions. We have to do some level of unlearning about even looking at the literature on gender and transport that developed in the context of the West or even other countries doesn't quite map out in relation to women here. Go ahead, Geeta. Yeah.
Sorry, I shouldn't be asking this question because I didn't hear most of the webinar, but I'm just curious. When these 5 guarantees were first given at the time of the election, and everybody saw in fact, there was a lot of excitement about them, and there was a lot of questioning about whether the government would actually be able to hold on and keep providing them. Did you find any difference? I mean, yours is a 1-point study, but you probably asked people. Is there a kind of settling down? Are the women who are using them kind of, okay, or is there still, if not an excitement, at least a solid backing for it?
Yeah, definitely. I mean, other researchers have also looked at it, and they seem to think that the pent-up demand for free travel has kind of stabilized. So there is that part of it. So with that, I suppose some level of excitement has gone down. But I think definitely when we looked at the guarantees as a whole, we did find that women, for example, because we were studying the guarantees and we were looking at treatment and control groups, for instance, we found that women who are getting the Griha Lakshmi actually felt that the Shakti had more of an impact on their work-related mobility and their work-related decisions. So we did feel like it was actually very beneficial to the women. But we also found other things. We still find the consistent complaints around how the improvement in the travel infrastructure is not actually kept up. So we have data on how women were actually paying more for private transport. Often when they had an emergency and needed to be somewhere in a reliable fashion, they were still opting for private transport, and they're willing to pay. That was the most counterintuitive thing that we found, and Madhusree also spoke about it in the context of this sample, that women are actually willing to pay for more reliable service because the backlash is real. The backlash continues to be there. So even at the 18-month mark, we were hearing about uh, you know still friction within buses picking up. All of that has actually not settled yet. Um,
Um, any other questions? I'm just conscious of the time as well. Nancy? Yes.
Hi, good evening. Thank you so much for this wonderful set discussion. I'm also a student working under this field of gender and transport. I'm working in the area Delhi and Patna. So I wanted to ask that have you observed any behavioral changes among the women post Operation Shakti? The way the change in any kind of like behavioral changes, like the way they present themselves or the dress, how they dress, or how they move in these public spaces or the public transport, or did you felt that women actually claim the space? Because we have this thing of dichotomy of private and public space, so there is debate कि these spaces, these reserved spaces for women are actually uh, kind of making private space in these public spaces. So did you observed any sense of or reclamation of space by these women using this public transport?
Thank you so much, Nancy, for your question. So again, I would reiterate on the point that this study was done in smaller peri-urban areas and rural areas where transport networks are limited, and women's mobility as a result is also quite limited. Uh, and while women felt, and as I presented during my there was a slide on how women felt about it, what women's experience were after Shakti, and they did feel more confident, they did feel more independent, because of course there was no money, it required no money and they could travel wherever they wanted to. And at the same time, they felt that because they didn't have to, ask for the family members for the money in case they needed to travel. So it did have a significant impact on how they, perceived dignity and independence after the scheme. But at the same time, I would say, like claiming of spaces, I think, yes, in their own terms, of course, yes, because women also said that they feel more safe in the buses now because there are more women traveling, but at the same time, due to infrastructural deficits, because in those rural areas or the smaller, settlements, the bus stops are not well lit. There is no washroom in most cases, or the waiting room is not open after a certain point of time. So those also impacted their feelings of safety and their feelings of independence. So there was a significant difference in safety during the day and during night. So they did claim the spaces in their own limited way, but there was definitely a change. It might not be as visible as, say, it is in Delhi after the pink ticket scheme, but there was positive changes in women's behavior.
Yeah, and also just to add to that, we found in the course of our focus group discussions and fieldwork in relation to the guarantees more generally that, women were engaging more in SHGs, their engagement with SHGs had gone up because of the Shakti scheme. Also, we were told that earlier, the women would not go to the parent-teacher meetings in the schools, but now because the bus was free, they were, men were happier for them to go and take on that kind of relationship. And I think some of the other researchers who looked at it also talked about its impact on female friendships, because I think certainly there is a sense of possibility where women who are neighbors might otherwise share, kind of exchange notes on their life experiences, were actually traveling together and making plans together. So I think there's a lot that's intangible that's still being documented. But the sense that the bureaucrats themselves also have, maybe answering one of the questions about whether, the cost benefit analysis, if this is a good idea, they're convinced that this is, as Uma Mahadevan called it, a runaway success. So the Shakti scheme has just so many social effects that, I think certainly the state is convinced that this has been one of the most successful guarantees of the five of them.
Thank you. Thank you so much.
Welcome.
Thanks so much. If there's nothing, yeah, I think considering that it's now 8 p.m. India time, thank you so much for joining us. Thank you, Madhusree, for the presentation and for the excellent questions and staying with us till now. We will be next month will be a seminar on Tamil Nadu's cash transfer scheme. And the month after, we hope to have the seminar on the 5 guarantees. Prabha has shared the links to the reports, but you can also find them on our website. So we hope to see you for the upcoming events. And thank you so much. Good night.
Thank you.